Bismillahirrahmanirrahim. Assalamu alaikum. Respected audience, today our topic of discussion is about a common problem nowadays we are facing, and that is weight loss surgery, or we call it bariatric surgery, and its possible complications related to eyes. More and more people are undergoing these procedures, so we decided to discuss this point also. So what are the possible complications, the problems the patient can encounter later on? So this will be our topic of discussion today. Bariatric surgery nowadays is done, if you speak technically, when the body mass index is more than 35. Obese patients, because of our lifestyles nowadays and irregular dietary habits, and carelessness in our diet plans, more and more people are developing this problem of obesity or overweight. And these patients, when they cannot control their body weight because due to exercise or diet plans, so they can develop cardiovascular problems, diabetes, high cholesterol levels, joint pains, blood pressure, hypertension, heart problems. Maybe later on they can develop stroke. So all these things are related to the weight. So in modern era now a solution came and people are undergoing, more and more people, that is bariatric surgery, and very effective in reducing the weight. And once it is done, the complications related to weight, I mean diabetes gets controlled, blood sugar level, cholesterol levels come under control, joint pains, heart problem risks are decreased. All these things which are related to overweight get under control. But there is a price which needs to be kept in the mind, the possible complications, and that is certain complications related to eye, which we are going to discuss now. So when we talk about the vitamins, there are 4 vitamins which are fat soluble. That is vitamin A, D, E, and K. Vitamin A is absorbed in 2 forms from small intestine. One is retinol form, that is animal derivative, and the other is carotene, that is plant derivative. After absorption from small intestine, this vitamin A is stored in liver in retinyl palmitate form, and it can stay over there for 2 years. Later on, it is hydrolyzed, and in retinol form, it makes a combination with proteins, and it goes to the target organs, tissues over there. Why it is very important? Retinol, vitamin A, when it is transported to the eye, it is of paramount importance in photoreceptors. Rods and cones depend a lot on the vitamin A for their functionalities. If there is deficiency of vitamin A, rods, which are usually involved for our vision in darkness, and cones, which are usually involved in our vision in the daytime, that are damaged, and their functionality is also disturbed. The second point is that these are also very important in the replication of corneal epithelial cells. They play a major role in the replication of messenger RNA, and a main role they play in the formation and over their cell division and all these things. So for the health of the corneal epithelium, they are vital. So when there is deficiency of these vitamin A, then the structures that I'm talking, particularly an eye, undercome stress and start developing problems and structural changes over there, which will be discussed in further slides. Vitamin A basically is absorbed from the first part of small intestine, that is duodenum, and when duodenum and earlier portion of the jejunum is removed, its absorption is substantially affected, and the patients then develop eye problems like conjunctival and corneal xerosis. As I mentioned, this is very important for epithelial regeneration. So patients start developing punctate epithelial erosions. When the condition aggravates, the cornea loses its luster, its shine, it becomes dry, and it can start undergoing melting that we call keratomalacia. So all these things are happening that we call corneal and conjunctival xerosis. Apart from this, as I mentioned, vitamin A is very important for the retinal pigment epithelium, which is a backbone of the photoreceptors involved in the vision. They also undergo damage, and patients start developing retinopathy. They can develop night blindness, which we call nyctalopia. So all these things happen because of the vitamin A deficiency. And as I mentioned, once the bypass surgery has been done, gastric bypass, the duodenum and the earlier portion of jejunum has been removed. So the absorption site is gone. No doubt the weight gets reduced, but this possible complication can happen. The second very important thing is when patients undergo surgery, their pre-albumin level concentration, the proteins, also get decreased. So protein calorie malnutrition is also related to the vitamin A deficiency. So all these things, absorption, protein calorie malnutrition, and oxidative stress after surgery, patient is not eating for a few weeks, a few days after the surgery. So all these things contribute when we talk particularly about the vitamin A deficiency. And it should be strongly suspected vitamin A deficiency if, as I mentioned, patient is having protein calorie malnutrition. So it is very important to give these patients supplements, and to keep in mind while going for this surgery that patients will later on need vitamin A supplements, vitamin A rich diets like carrots, tomatoes, spinach, pumpkins. These are relatively having more concentration of vitamin A to make up the compensation. So that was the thing I wanted to discuss today, because now more and more people are undergoing bariatric surgery. Of course, it is very beneficial and to control medical and health issues and weight reduction, but there are certain things which should be kept in the mind that patients can develop, and these things should be catered off later on. And because their deficiency will ultimately affect, because in severe conditions when vitamin A deficiency is there, then eyes can have dryness, and I told you keratomalacia, dryness, melting, night blindness, all these things can happen over there. So I hope my today's presentation, a brief presentation about the role of vitamin A and its deficiency after this gastric bypass surgeries will be beneficial for my respected audience. I want to thank you for your attendance and attention. Thank you.